Hi, Mr. O'Toole. Happy New Year. While we could, yes, it's true that tests can absolutely detect COVID-19. The reality, though, is that it's the unvaccinated who are at greatest risk of ending up in ICU, and it is the unvaccinated that are at risk of overwhelming the healthcare system, and in turn, it is the risk of overwhelming the healthcare system that is the reason that we're all locked down. So the question I have is, why should the unvaccinated be accommodated if it is their decision to get unvaccinated that is leading to part of the crisis in the healthcare system?
Well, you've raised an interesting thing there, Stephanie. You're absolutely right. The incident rate in ICUs will be far greater for non-vaccinated. That's why we have to get as many people vaccinated as possible. If Mr. Trudeau's rhetoric, calling people names, was effective, we wouldn't have that problem. But what we found with Omicron, if you actually look in a total way at the data, is you're also going to have some hospitalization and a lower number of ICU admission for people that are fully vaccinated. In some cases, even with the booster, as we're seeing out of Denmark and other studies that are literally being watched on a daily basis. So the more we can give all Canadians tools to keep the spread down and to keep normalcy to life is what we have to be doing. What is crazy is we haven't learned the lessons from the first wave. We're back to ordering PPE for Parliament Hill from China. We haven't delivered the rapid tests promised almost 2 years ago on his doorstep. He orders them in the middle of the fourth wave. That's unacceptable. So we need to keep strain off the healthcare system as much as possible, and giving Canadians, communities, schools those tools is part of that.